Walking pneumonia, despite its mild reputation, holds a hidden danger. Many of us, busy with daily life, may unknowingly walk around with this infection, risking not only our own health but also the health of those around us. Often mistaken for a stubborn cold or a mild flu, walking pneumonia is a lung infection that can sneak up with symptoms like a sore throat, sneezing, headache, and persistent low-grade fever. It's contagious, easily spreading in close quarters, workplaces, schools, dormitories, and crowded public spaces, making it a risk that's hard to escape. While most of us could potentially recover on our own, in some cases, this seemingly mild illness can take a serious turn, especially if left unchecked. So, what exactly is walking pneumonia? Walking pneumonia, medically known as atypical pneumonia, is a milder form of pneumonia that affects the lungs without the full force of regular pneumonia. It involves an infection that causes the air sacs in the lungs to fill with mucus and fluid, which restricts oxygen flow, but does not completely debilitate the person affected. As a result, many people continue to go about their daily lives, unaware of the true nature of their illness. This lack of awareness can lead to complications if the infection worsens or lingers untreated, which is why understanding the symptoms, causes, and proper treatment of walking pneumonia is essential. By following expert advice, you can better manage symptoms, reduce contagion, and make informed choices about when to seek medical intervention. The causes of walking pneumonia can vary, but they're usually due to a bacterial infection, with the most common culprits being Mycoplasma pneumoniae bacteria. However, viruses or molds can also be to blame, regardless of the cause. The symptoms often start subtly and feel familiar, like the early stages of a cold or flu. You may experience a scratchy throat, cough, sneezing, or mild chills, accompanied by a low-grade fever. The deceptively mild nature of walking pneumonia means many people dismiss it as nothing serious, which increases the risk of spreading the infection to others. Those with weakened immune systems, such as older adults, young children, or people with chronic health conditions, are particularly vulnerable and may face greater risks if exposed. Walking pneumonia is not only common but highly contagious. When an infected person coughs, sneezes, or even talks, tiny droplets containing the bacteria or virus are released into the air, where they can be inhaled by others. This is why people working or living in shared spaces, like nursing homes, dormitories, or military barracks, are at a higher risk of contracting it. You may unknowingly be contagious for 2 to 4 weeks before symptoms appear, a period known as the incubation period, during which you could be spreading the illness. Once symptoms appear, you remain contagious until the symptoms end. This can complicate efforts to control the spread, making it vital to take preventive steps to protect yourself and others. To diagnose walking pneumonia, healthcare providers typically rely on a physical examination. They listen to your lungs with a stethoscope to detect abnormal sounds, and may also ask about recent contacts with sick individuals or environments where contagion is likely. In some cases, if symptoms suggest a more serious infection, doctors may order chest X-rays or take samples of mucus or blood to confirm the presence of infection. While walking pneumonia is mild enough that it often doesn't require hospitalization, a healthcare provider's evaluation can be instrumental in determining the best course of action, especially if symptoms persist or worsen. If diagnosed, the treatment for walking pneumonia depends on the underlying cause. Bacterial infections are typically treated with antibiotics, such as macrolide antibiotics like azithromycin or clarithromycin. It's crucial to complete the full course of antibiotics even if you start feeling better to prevent a relapse and to reduce the chance of antibiotic resistance. In cases where walking pneumonia is caused by a virus, the treatment focuses on relieving symptoms with over-the-counter medications to manage fever, cough, and congestion, warm fluids, rest, and using a humidifier can also provide comfort and help relieve congestion. Taking NSAIDs can help reduce fever, but always consult your healthcare provider before starting any new medication. If left untreated, walking pneumonia can persist and potentially lead to complications. In rare cases, especially in vulnerable individuals, untreated walking pneumonia may worsen into a more severe respiratory infection. Persistent symptoms, like a lingering cough, may last for weeks or even months, impacting your quality of life. Thus, if you suspect you have walking pneumonia or if your symptoms do not improve within a few days, seeking medical advice is essential. A healthcare provider can prescribe antibiotics or recommend appropriate care, helping you recover more quickly and reducing the risk of spreading the infection. Prevention is key to avoiding walking pneumonia. Simple steps like covering your nose and mouth when you sneeze or cough, washing your hands frequently, and avoiding close contact with sick individuals can make a big difference. For people at higher risk, like those with asthma or other respiratory conditions, wearing a mask around others can help reduce the chance of infection. While there is no vaccine specifically for walking pneumonia, getting an annual flu shot can help protect against respiratory infections that may lead to complications. If you smoke, quitting is one of the best things you can do to support your respiratory health, as smoking can make symptoms worse and weaken your body's ability to fight off infections. Living with walking pneumonia can be a challenge, especially since the symptoms may drag on. Most people feel better after a few days of treatment, but the cough may take longer to resolve. During this time, focus on rest, hydration, and following your healthcare provider's advice on medication. If your symptoms don't improve or you experience a worsening of symptoms, a follow-up appointment can help assess the need for additional treatment or changes in care. It's also a good idea to talk with your provider about any questions or concerns you may have, including the duration of antibiotics, potential side effects, or possible interactions with other medications. While walking pneumonia may be mild compared to other respiratory infections, it's not something to be ignored. Taking it seriously, seeking appropriate care, and adopting preventive habits can go a long way in managing this condition. And as you continue learning about health and wellness, consider subscribing to Dr. My's YouTube channel, where you'll find insightful content on a range of health topics. Join our community, and don't forget to like, comment, and subscribe for more updates on how to safeguard your health and stay informed about critical health issues.